Good morning, student. Today I want to uh, discuss or explain about the effect of fasting or starvation on human body. So, starvation or prolonged caloric restriction has severe effects on human body. Here are some of the short-term, long-term consequences. So short-term effects that happens between the 1 to 7 days of fasting are dehydration, electrolyte imbalance, fatigue, headaches, dizziness, nausea and vomiting, confusion and disorientation, decreased blood pressure, slowed heart rate and reduced body temperature. So among them, the dehydration is the most severe form of uh, complication. Now, there are three stages of dehydration. First is the mild, when there is 3 to 4% fluid loss due to inadequate fluid intake. During this process of fasting or starvation, dehydration happens. It is mild when 3 to 4% fluid loss is there. Moderate when 5 to 8% fluid loss are there. More severe symptoms will be present, and the severe when 9 to 12% fluid loss is there, so there will be life threatening symptoms. Now dehydration often leads to metabolic acidosis. That is very important. There may be the lactic acid accumulation from anaerobic metabolism, reduced bicarbonate reabsorption in the kidneys, increased production of acid metabolites. So as a result, in the body the acid is high, in the blood the acid is high, so there will be low pH and low bicarbonate, normal or low partial pressure of carbon dioxide, and the calculated anion gap, it will be elevated. Now a mild dehydration as the pH level is high, so it will stimulate the respiratory center, so there will be hyperventilation. So when the person is hyperventilating, that there will be more carbon dioxide washout, so um, partial pressure of CO2, it will be low. Okay, so as the dehydration progresses, so initially there will be metabolic acidosis associated with the respiratory acidosis, but as the dehydration progresses, there will be metabolic acidosis along with the respiratory alkalosis. Now in the severe dehydration, there will be lactic acidosis. It is a very crucial and fatal state where there will be high lactate level, because there will be more anaerobic glycolysis in our body. So low pH, low bicarbonate and elevated anion gap, and treatment has to be intervened in this state in order to prevent death. Now, in addition to that, the starvation can result in so many electrolyte imbalances due to less dietary intake, increased urinary excretion, and some hormonal changes and cellular shifts. Among them, most important is the hypokalemia or low potassium. So, this low potassium can cause cardiac arrhythmias or cardiac arrest. There will be muscle weakness, fatigue, and constipation. Hypophosphatemia will be there. That will also cause the fatigue and muscle weakness and the respiratory failure. And the hypocalcemia, that is a low calcium, why it will happen? Due to vitamin D deficiency, magnesium deficiency, and the alkalosis. The symptoms will be muscle cramps, tetany, even seizures, and also the cardiac arrhythmias. Now, in addition to that, there may be hyponatremia, low sodium, that will cause the headache, nausea, vomiting, confusion, and seizures. Hypomagnesemia will be there, that will cause muscle cramps, arrhythmias, and seizures. And other electrolyte disturbances may be hypochloremia, metabolic alkalosis, and the hyperuricemia. Now, if the starvation is continued more than 7 days, what will happen? So the medium term effect will be the weight loss, loss of appetite, skin problems, poor wound healing, and most importantly, the decreased immune function. They are more susceptible to infections, anemia, reduced muscle mass and stress, and there will be menstrual irregularities. And the long term effect beyond the 4 weeks, the chances of multi organ failure is very high. There will be edema, cardiovascular diseases, there will be impaired cognitive functions, CNS, the person will not identify. and there is increased risk of mortality. Now, what is the pathophysiological basis of all these symptoms? So we can see from this graph that in the fed state, when we are taking food, the glucose level is 5.5 millimole per liter, free fatty acid is 0.3 millimole per liter, and ketone body is negligible. So when we are fasting and it is beyond 40 hours, we can see that glucose level is decreased, whereas free fatty acid and ketone body levels are increased. After 7 days, we can see glucose is less. The ketone bodies and free fatty acid levels are very high. They have very important clinical importance to cause all these symptoms. So when the glucose level is less, so all these changes will happen. So normally what happens when we are taking food, these glucose will be utilized in our body. It will generate the ATP or ATP or energy, and the byproducts of this aerobic pathway will give some enzymes that will help in the storage of fat in our body. Okay, in the food will also contain the protein that will help in the growth of our body. So energy and growth, these are the two things that is done by the food, by these metabolic pathways. It is the anabolic pathways of protein and the lipids, and also the glycolytic pathway, TCA cycle will generate of the glucose will give the energy. So when we are feeding, when adequate amount of glucose is there, so what is the adequate amount of glucose? 120 to 140 milligram per deciliter is a normal range. If it is more than that, that is not good. If it is less than that, that is also not good. So when it is in the fed state, it is beyond 140 milligram per deciliter, what will happen? This will be sensed by our pancreatic beta cells. These pancreatic beta cells will release a very important hormone, that is the insulin. This insulin has three target organs. One is the skeletal muscle, another is liver, another is the adipose tissue. Okay. So what will do this insulin? Insulin will try to disperse the glucose. It will enhance the entry of excess glucose into the liver, skeletal muscle, and adipose tissue. Okay, so in the liver, this glucose will be converted to glycogen, will remain stored. In the muscle, this excess glucose will be converted to muscle glycogen and will remain stored. And in the adipose tissue, it will form the fats. Okay, triglycerol will be formed. So in this way, the blood glucose level will be maintained within this narrow range. So the function of insulin is to disperse the excess glucose into these three target organs. Now here I want to highlight one graph. We can see that along the x-axis, the hours of starvation is mentioned. Along the y-axis, the changes of different factors are mentioned. I want to highlight two special things over here. One is the plasma insulin level and the plasma glucagon level. You can see here, as the starvation increases, the plasma insulin level is decreasing and the plasma glucagon level is increasing. So in glucose less, so insulin less. Instead of that, the islets of Langerhans of the pancreatic cells, they will secrete glucagon. So now what is the function of this glucagon? Glucagon will try to prevent this entry of glucose into liver, skeletal muscle, and the adipose tissue, so that the glucose, we know that we are taking less amount of glucose, or in our blood we have less glucose. So as it is not dispersed or distributed into these target organs, so the blood glucose level will be maintained for a while. Okay, for a short period of time, this will be able to maintain the blood glucose level. But if the starvation or fasting, it goes beyond 40 hours, what happens? This function will not work. We can see that glucose level is decreasing. Okay, so then body has to take some other methods. So what are those other methods? First is in the liver, they will try to convert the stored glycogen to glucose by the process glycosenolysis. so that the glucose will come in the blood and maintain the blood glucose level. Second thing is that from the protein there will be formation of glucose by the process of gluconeogenesis. So the second step is that when when the entry of glucose, it is prevented and this effect is not working, so now the body will try to produce glucose from the glycogen by the process of glycosenolysis, and also from the protein by the process of gluconeogenesis to maintain the blood glucose level. So another factor is also important, that is the utilization of fat, because energy, we can see here the energy yield per kilojoule per gram, it is maximum in the fat. Okay, so fat can also will be utilized to maintain the energy of our body by the process of beta oxidation of fat. So now we will focus on three things. One is the glycosenolysis, the second is the gluconeogenesis, and third is the beta oxidation of the fat. So this is the glycosenolysis pathway. So we know that the liver glycogen is 90 gram and muscle glycogen is the maximum, that is 245 gram. And there is extracellular storage of glycogen as well, this is 10 gram. Now, the principal two enzymes that control the glycogen metabolism is the glycogen phosphorylase, that is on the right hand side, and the glycogen synthase. So, in the starvation and the fasting state, this glycogen phosphorylase enzyme, it will be increased. Okay, how it will be increased? It is increased in response to cyclic AMP that is formed by the ATP by adenyl cyclase at the inner surface of the cell membrane in response to the hormones like glucagon. Also by the epinephrine and non-epinephrine. So insulin is not working. Insulin is actually inhibiting the CAMP. So when the glucagon is working, so CAMP is increased, and that will facilitate the glycogen phosphorylase enzyme, and ultimately from the glycogen there will be formation of glucose. Now one point I want to highlight here, that is a muscle phosphorylase, it differs from the liver isoenzyme in having a binding site for 5' AMP, which acts as an allosteric activator of inactive dephosphorylated B form of the enzyme. So this glucagon mediated glycogen phosphorylase activation, it is not possible in muscle. Muscle glycogen will not be utilized in this process. So glycosenolysis is there, glucose is formed with the help of glucagon. Now second point is the gluconeogenesis. We can see here, this is a gluconeogenesis pathway. Okay, so here we can see that the enzymes which are very important for this gluconeogenesis process, they are double arrowed or double lined. We can see the pyruvate carboxylase is the enzyme. Another that will convert the pyruvate to oxaloacetate, then malate. Malate will go outside the mitochondria, and here outside the mitochondria, pyruvate will be converted to phosphoenol pyruvate. Okay, phosphoenol pyruvate. So we want this reaction. So this reaction, the forward reaction is from the glucose, there will be formation of pyruvate to, it will go to the TCA cycle, there will oxaloacetate. So now we are trying to move on the opposite direction. So we will move from pyruvate to phosphoenol pyruvate, then to phosphoglycerans like this, 2 phosphoglycerate, 3 phosphoglycerate. In this way, ultimately we will reach the level of glucose. Now what are the enzymes that will help? Most importantly, this phosphoenol pyruvate carboxykinase is the enzyme. Another enzyme that has to be inhibited is the pyruvate kinase enzyme. Okay, so pyruvate kinase has to be inhibited. Other enzymes which are responsible are also the fructose 1,6 bisphosphatase, glucose 6-phosphatase. All of them will ultimately result in the end product of glucose. Okay, so And from this graph we can see that when the glucagon level or the glucocorticoid epinephrine levels are high, so all these enzymes, that is the pyruvate carboxykinase, glucose 6 phosphatase, pyruvate carboxylase, all these enzyme levels are high, so they are favoring the gluconeogenesis, whereas the glycolytic enzyme